Hello, my name is Brittany Bennett, and I will be going over the left lateral skull. Patient preparation. Confirm patient's identity in 3 ways: wristband or paperwork, and then asking the patient to state their name and date of birth. If female, confirm the last menstrual cycle date. Confirm with the patient what we are imaging to confirm that the order is correct before imaging the patient. Make sure to shield the patient with the appropriate lead shield. Make sure to remove all jewelry or metal in the area of interest. Ask the patient to remove the undergarments in the area of interest. IR size is 10 by 12. IR orientation is landscape. IR location is Walbucky. SID is 40 inches or 100 centimeters. Patient position is patient is erect or semi-prone position. Part position, the patient's head is in true lateral position with the side of interest closest to the IR. MSP is parallel to the IR to avoid rotation and tilt. IPL is perpendicular to the IR to avoid tilt. Adjust neck flexion to align IOML perpendicular to the IR. CR location, the CR is perpendicular to the IR. Center the CR 2 inches superior to the EAM. CR angulation, there is none. Collimated field size. Collimate to make sure that you get the whole skull, however, the mandible can be clipped. Visual of appropriate marker location. We have the left marker in this case, since it is a left lateral skull, and it's in the facial area because that is not the area of interest. KVP range for a real patient would be 75 KVP. Instructions to the patient for exposure. I would ask the patient to not move from position, but to give them instructions to take a deep breath in, blow it all the way out, hold it, and expose on suspended respiration. Anatomy demonstrated. The entire skull is demonstrated and superimposed parietal bones of the skull. The entire sella turcica, including the anterior and posterior clinoid processes and dorsum sellae, mandibular and rami, and greater wings of sphenoid, superimposed orbital roofs, mastoids, and EAMs. Items in profile are the sella turcica and the clivus. Pathology best demonstrated would be skull fractures, neoplastic processes, and Pagets disease. And then on a cross-table lateral, we'll demonstrate air fluid in the sphenoid sinuses. You will also be able to locate the superior cranial cortex, inion, parietal bone, anterior clinoid processes, posterior clinoid processes, occipital bone, temporal bone, mastoid air cells, mandibular rami, C2 vertebrae, anterior cranial cortex, frontal bone, frontal sinuses, glabella, nasion, OML line, sella turcica, mastoid sinuses, dorsum sellae, and clivus. Thank you so much for your time.